Welcome to True Health Tuesday, and the truth will set you free. Okay, if you've noticed, has anyone noticed that there is a censorship issue in America? Okay, well, now that the National Socialist Party has taken no, I'm sorry, that was a flashback to World War II. Oh gosh, how bad could I be? Okay, but when you look at this, there is a huge amount of censorship going on. I just wanted to show you this because this was the Miss Beautiful Spine pageant. Just a snapshot to an earlier time. Okay, now we have a lot of educational videos on injections. I guess I can't say vaccines anymore. And we have a lot of things on EMF, and we can't say Cinco Hey anymore. That's the 5G. Oh, I didn't say that. Okay. You can't mention that vitamin C is good for anything or that it has been proven, even though if you're measuring a study. This is interesting, though. A state health commissioner said he plans to mandate corona vaccines. And the Facebook is now saying ads will explicitly discourage vaccines, including portraying them as ineffective or unsafe. Anybody that says that, it will be banned. And so consequently, don't look at any of the trials for the experimental rushed vaccine. So now let's get into the lumbar and pelvic, because this is hugely important. Okay, now also too, we have a lot of different subscribers on YouTube and over 100,000 on Facebook, 700 on YouTube, and they're shadow banning us now. So if you getting this and you say, gee, I thought you stopped making videos. I honest to God look for them, they're all on our other sites. But this is one of the crimes that we have to stop. I mean, yes, they can ban you're talking about vitamins. They can ban certain conditions. They can ban you discussing forced medical procedures because the First Amendment isn't really important. But this is a freaking crime. Okay, this is one of our patients. What you're looking at here, that side view of the low back, is a reversal of the curve that they fused it in. First, they went in and put some bolts, and that still caused pain. Then they put a longer bolt in and replaced all of the discs. Those are all completely fake discs in there. Now it caused so much pain that they took the bolts out of the middle. So they only have a bolted section on the top and a bolted section on the bottom. And surprisingly, the patient is still hurting. So what we did, now by removing the parts, because they actually remove parts of the bone in order to stick in some of the bolts, it's called a laminectomy. And some of the structures in there control muscle tone, they control communication of the brain. One of the things that we have to do with understanding how the body works is to prevent travesties like this. And this was not an accident. Okay, he wasn't paralyzed or anything. Okay, it was discomfort and pain. And they said, look, you got some damage, let's fix it. So when we're looking at this, and we have to prevent that, and this is looking at the difference of a lumbar problem or disc injuries and the pelvis. This is the most commonly missed thing. But look at how beautiful your structure is. You've got a central nervous system that's completely encased in bone. You got this brain and spinal cord, but it's got to be strong and flexible. Strong and flexible. That's not easy. Now, if you're looking at a pelvis, and you know how you can tell, I'm going to tell you how to tell a male from a female. This is a male pelvis. No, there's nothing there. But you got to think martini glass for male, margarita glass for female. So you can tell pretty easy. Okay, so that's kind of cool. But the way this is designed is amazing. There's no muscle that actually crosses the back half of this joint. So it's nearly a perfect joint. The problem is when you're sitting on this joint, you're sitting on this butt bone here, the ischial tube, and that can destabilize it. That's why sitting is a challenge. But imagine a structure that's so good and so stable with all those ligaments up there that you don't even need a muscle that crosses the back half. The problem is when you have a dysfunction here, half of the parasympathetic nervous system is located in the sacrum. And it's not called a tailbone, okay? You don't have tails. I know, a person in the back just goes, oh my gosh, he's a creationist. No, this is a sacrum. This is your species, okay? And they called it the sacrum because it's a three-sided bone, they thought Father, Son, Holy Ghost, and they wanted to approve human dissection, so they found the case that held the soul. And the priest at the time said, yes, you could do human dissection, you just had to make sure the soul wasn't there. So they found the case that held the sacred case, and they said, yep, it's empty, you can start dissecting humans. I know, Trivia Pursuit, dude, have me on your team. Okay, so when you look at this, problems with the pelvis, you got the pelvic floor, so they're talking bowel and bladder control, sexual dysfunction. I mean, leg pain, knee pain, because the sciatic nerve goes right through there. The biggest problem is people looking at muscles. Now, when you look at this, you've got the three different glutes over here. Gluteus medius is the main hip stabilizer. But how many times have you heard, yeah, it's that tensor fascia lata, it's that TFL, or it's the psoas, or it's this, or it's that. Muscles don't react on their own. But what happens is, gluteus medius is one of the coolest muscles ever. It's actually one of the hip stabilizers. So if you stand here and lift up one leg, the opposite side has got to tighten up. So if you have any kind of pelvic dysfunction, any kind, that means you fell on it. Gymnastic, dancing, whatever. If you have this thing irritated, the muscles are going to tighten up to try and stabilize it. Now you only have one muscle that crosses the front, and that's the piriformis. So if you're looking at a muscle, you're looking in the wrong place. But also, when we look at this, patellar tracking, see those knees over there? You're going to see like a white shaded thing. That's the kneecap or patella. Is it in the middle or is it off to the side? It's off to the side. And you'll see abnormal patellar tracking has a causative factor of a lot of knee problems when the knee joints are fine. So when we look at piriformis syndrome, anytime you have somebody that says syndrome, imagine driving your car to a mechanic. Yes, you have carburetor syndrome. No problem? What do you mean it's fuel injected? Okay, whatever. Okay, so when you look at this, the piriformis, it's not a syndrome. Okay, any muscle that if you got a chronic spasm of muscle, think that the body's intelligent. Don't just nilly-willy relax it and loosen it up, because that doesn't make any sense. But particularly if you got the gluteus medius and the piriformis firing off, or an asymmetrical muscle spasms, you got to figure that, gee whiz, it's probably an unstable pelvis. Now, how can you tell? And this is one of the things I do on every patient that comes in. If they come in with long-term low back problems, what does that mean? First off, it's probably a symptom that there's something wrong here. I know. Whoa! Back pain means a problem with the back. Yeah, maybe. Okay, but also, if you have any problem in here, and the way the body works is if there's any kind of trauma, damage, or anything, the muscles that run from here at the base of the skull all the way down to the bottom, there's no conscious control. Okay, so they increase in tone under proprioception, under your body's position in space. So if your head goes forward, those muscles are going to tighten up. Your body goes off to the side, the muscles on the outside portion of the curve are going to increase in tone. So these are under not conscious control. If you're scared or have an anxiety attack, okay, or you're watching a Terminator, which, when was Terminator set in? What year? Yes, 2020. Okay, just checking if you knew that. Okay. Yeah. Okay, so when you're looking at it, those muscles aren't under conscious control. So if you have a problem here, any kind of a nerve issue, those muscles are going to tighten up. So what happens? The area above and below got to move twice as much. So if somebody comes in and they say, wow, I've had this back pain for 4 or 5 years, take your shoes off. Let me check your feet. Why? Because the nerves that supply the feet come out of the base there. And when you start to see a flattening of foot or distortion, that bunion there is not growing. It's the muscles around it that are atrophying. That's hugely important because that means the foot is flattening out, the distortion in there. So that's over 10 years of distortion in that foot. That means this person's had compromised nerve supply in that foot for at least 10 years based on that damage. It's not from the incredibly good-looking shoes. Okay? High-heeled shoes are okay for women. Why? Why? Because you feel pretty and guys like looking at you. There's nothing wrong with them. Okay, I'll show you how to fix the damage. It's okay. But with 3 sisters, my mom was a 40s glamour girl. We had to give her high-heeled tennis shoes even. Okay, now why is looking at the sacrum important? Because the sacrum houses that parasympathetic nervous system. So when you start to see foot distortions, you got to start thinking, wow, this has been a long-term unstable pelvis. And so that means that the fight or flight system is going to be activated, the sympathetic nervous system. But since this sacrum houses the parasympathetic half of it, parasympathetic is here and in the skull. That means resting, digesting, and repairing. So what are they going to have? Slow gastric motility. They're going to have poor digestion, bloating, gas. All of these symptoms are clues to a body adapting to a stress state. They are clues to a body adapting to a stress state. So if you have, a tight tensor fasciae lata or a tight gluteus medius and the guy does the work every time and you feel great afterwards, why is it tight? You got to answer those questions. Here's a patient and you can see her standing up. It's not exactly straight, is it? No. So what I'm looking at on this, I'm looking at multiple areas of trauma, subluxation, trauma that has been adapted to. So it was an initial trauma. Then her body's adapting. Does that make sense? So there's an adaptation to the trauma. Now you're looking at an abnormal bowel gas there, which means that she's had compromised blood supply or nerve supply to that gut area for a long time. Now this is important because that's 80% of the immune system. It's also where neurotransmitters are produced. So when you see an abnormal bowel gas like that, you're looking at anxiety, stress, depression. And then if you're a doctor that doesn't have a clue about physiology and there's no blood test that shows you, then you give them a diagnosis of a condition that you have no clue at where it's from. You call it fibromyalgia. And let's call it, remember, fibromyalgia syndrome. Okay? So this is what's happening. Bowel and bladder dysfunction? No. Her body was responding correctly based on the stimulus. Correctly. Okay? And that's what you got to know because your body is self-healing and self-regulating. The worst part of this is if you understand that you've got a brain. Okay, well, no, I'm not talking about politicians. Settle down. Jeez. Russians? Okay, so when you look at this, but she is right. Okay, the brain's up here. The frontal lobe, okay, is an anxiety, stress, impulse control, and this is schizophrenia. Everything is in that frontal lobe. You got a little brain in the back called the cerebellum. That little lines in there, that's called the arbor vitae, the tree of life. I mean, it's just brilliant. Now, any kind of movement that you have in the body stimulates or gets all of these sensors in here. I mean, there are so many sensors. You've got joint mechanoreceptors that have proprioceptive or tells your body position in space. You've got the intrinsic muscles that have muscle spindle receptors that send proprioceptive signals in there. Even the ligaments have sensors in there. So all of these sensors, yes, they did cut them out of that first patient. I know. The doctor in the front just groaned. I know, I'm with you, brother. Okay, so these sensors communicate to the brain, but they also communicate to that cerebellum, and this controls the frontal lobe. Why is that important? Cerebellum plays a role in function, creativity, attention, planning. Tourette's, schizophrenia, autism spectrum, Parkinson's, addictions, OCD. What's our health czar? Wash your hands and stay away from people. Okay, that's not OCD. Yes, it is. Okay, so when you see this, if you see a foot distortion, start thinking there's a lumbar disc problem and a pelvic dysfunction, because this is hugely important. You can't have one without the other. If you have just a lumbar disc injury, do you think that having that lumbar disc injury, knowing that the muscles are going to tighten up here, do you think the pelvis is going to be functioning perfect? No, it can't. It's an adaptation. It's an adaptation. Anxiety, skin issues. Why skin issues if you've got a pelvis issue? because that puts you in a chronic sympathetic dominant state. What happens under that? You have low stomach acid. Low stomach acid, you can't break the proteins to amino acid, so your integrity of your tissue starts to break down. Poor sleep patterns. What happens when you're sleeping? You regenerate your body. If you have sleep patterns interrupted, you're looking at chronic critical disease. This is a system failure. Now, discs, when you look at this, discs are incredibly tough. They have a horrible blood supply. Why? Because they're under such great force loading. I mean, if you take a human body and cut it from here up off, you're talking a disc about the size, a little bit bigger than a 50-cent piece. Now, that's going to have maybe 100, 200 pounds of force on it. If you step off a curb, it's going to be more. So blood vessels would be compromised in that. So the discs get their nutrients through movement. And what a disc is 80 interconnecting ligamentous rings of tissue. It is so tough. You can literally take a probe, pass it through bone pretty easy. You can't beat it in a disc with a hammer. Now, slipped, bulging, herniated, you might have heard all those terms, okay? Well, what happens is you can regenerate it. Now, here's a series of x-rays over about 3 years, and you'll see it's a side view of a low back looking at this, and you'll see, very little space, like it's crushed and you can't even see it. Ignorant physicians that are working on a carburetor, ignorant physicians that are working on a syndrome, they'll say, it's bone on bone. Okay, no, it's not. Okay, for one thing, a rotation can distort it. That means if you have a spine and you're looking at this direction and you have a lateral bend in it, okay, you will not be able to see that disc space. So this is two things going on here. One, the disc is going to be regenerated, but think of this. Can you see a space in between my hands? Can you see a space in between my hands? No, it's there. Okay, but if you can magically look through this, you can actually see the base of the other one, and that's what we can do with the x-rays. Now, how come doctors don't see this? How come they don't know about this? What's the number one drug that you would get if you have pain? No, opiates. Opiates, that's a good one. Ibuprofen, okay, non-steroidal anti-inflammatory. Why not? Or Tylenol. Nobody knows what that is, but it has a similar effect, okay? It destroys the building block of cartilage. So if you have a protocol where pain drug, and the drug happens to destroy the building block of cartilage, you're not going to see a lot of disc regeneration. And so what we've got is a mechanical distortion of the spine. That means that this body has had a trauma. Okay, now imagine if you had a 12 to 15 pound head and you accelerated this body, this beautiful curve, from 0 to 50 miles an hour in about 200 feet. And then let's say you decelerated that from 50 miles an hour to 0 in 30 feet. And then you accelerated again and then decelerated. I'm just talking about going to the 405. It's like a 5-minute drive, okay? But our necks aren't designed for that. Our necks are designed to hold this 15-pound head and have a very, very mobile attitude so we can survive. So when you straighten this curve, you have less range of motion. You want to demonstrate? It's pretty cool. Okay, so sit up straight in your chairs. Okay, now put your head really far forward. Okay, as long as you don't have surgery, you can do it. Now, see how far you can turn it one side, how far you can turn it the other side. Okay, now reposition it. Get the chin up, curve back. Now turn it one side, turn it the other side. Oh my gosh, look at that. You can turn it better. What does that mean? That means that we have joints set at a 30-degree angle in the cervical, 60-degree in the thoracic area, 90 degrees in the lumbar, and that if you put that curve back, you have better range of motion. Wow! Okay, so anyway, what happens is, for every 1-inch range of forward head carriage, the pressure on the discs double. Now, is the body smart or smart? Smart. Thank God. Glad somebody would get it right. Okay, so that means that the muscles back here are going to fire off like crazy to reposition it. And these are muscles that aren't under conscious control. The problem is, think of this, it takes 3 to 5 years to see a bone change on x-ray. So when you're looking at the first grade 1 arthritis in here, there's no change in the disc or the bone. You look at the second one, you're seeing a compression of that disc. Why? Because discs get their nutrients through movement. Movement. If you alter that movement after a trauma, that disc gets closer. And so what happens is the body builds these bone spurs to protect you, to stabilize an unstable segment. And how do we know that? The Managing Low Back Pain by Kirkcaldy and Willis, this is like a Bible, okay, when it comes to mechanical distortion. And when you're looking at biomechanics, they took cadaver bones and of young cadavers and old cadavers, put them under compression torsional testing, and they found the old ones were just as strong as the young ones. I do take offense to that. I think the old ones are stronger than the young ones, but I just have personal experience. Okay, so when you look at this, it's a trauma. It's called degenerative disc disease, even though it's not a disease, it's not degenerative, it's adaptive, and it's from a trauma. Now, this is one of the problems that people have had because it's misnamed. It was misnamed years ago and it still is misnamed. It's called osteoarthritis. Arth means joint, itis means inflammation, but there's a non-inflammatory joint inflammation. Yes, let me say that back slower. It's a non-inflammatory joint condition that's in an inflammatory category. Now, let's see how accurate MRIs are, because what happens is, do you have a lot of doctors taking an x-ray, pre-x-ray, post-x-ray? They're going to look for fractures, tumors, or cysts. The problem is they're not looking for misalignments. They're not saying, wow, you have a 50% loss of curve in the neck and your head's forward about an inch, and we're starting to see advancing degeneration over C5, C6. We've got to get this man to the chiropractor stat. Okay. Don't smile. I guess someday that's going to happen, okay? I know. No, here's an Advil. Okay, so when we look at this, we're looking at a reversal of the curve on an x-ray. We're looking at an MRI next to that. The problem is, how accurate is an MRI? How accurate? I mean, the picture looks really cool, doesn't it? The picture looks cool. I think it's amazing to see through I look at MRIs all the time. The problem is the position distorts the MRI. You're laying down generally for most of this. Now, you've got, and I'm going to put this in a normal configuration, you've got a lordosis in the cervical and lumbar. You've got a kyphosis here. Now, this is a person standing upright. Should be straight like this, should be curved like this. I don't know, let's lay him down. Bam, so now you got the head pushing up, the thoracic pushing up, and the pelvis pushing up. And then you're laying down, so now let's put a magnet around this at really, really high powerful magnet. And then it's going to face all the hydrogen ions in one direction, so then the computer can interpret it. Yes, I said the computer can interpret it. Now, inflammation can distort that interpretation, and body position can distort it. Stephen Brownstein. Significantly more pathology is discovered on an MRI done if the patient is standing or neutral or standing in extension compared to the conventional MRI. Here's the London Department of Radiology, Royal National Orthopedic. I like the way they write that. Supine magnetic resonance imaging is routinely used in the assessment of low back pain and radiculopathy. However, image findings often correlate poorly with clinical findings. Wait a second. Image findings often correlate poorly with the clinical findings. That means that this is a distorted image. So when people come in and they bring me their MRIs, I'll say, cool, did it have any like tumors, fractures, something neat? And they'll look at me like, no, it just showed a disc bulge. And I says, well, it's not accurate for a disc bulge. Inflammation distorts it in body position. We're going to take a stress x-ray, we'll find it. How common is that? By far the number one reason back surgeries are not effective and some patients experience continued pain after surgery is because the lesion that was operated on was not in fact the cause of the patient's pain. Was in fact not the cause of the patient's pain. So utilizing, and then here's another challenge too. See, when somebody comes in with back pain, insurance is going to tell you, look at the back. And that's foolishness because you've got to look at the entire structure. Did this person have a horse fall, slipped on skating? Then they had that, in college, okay, they fell down a staircase. None of this stuff was addressed. but I got into an accident. This is what I'll tell patients. I said, have you ever been in an accident? Oh, yeah. Yeah, I wasn't hurt at all. Was the car totaled? Oh, yeah. It didn't feel a thing. Okay, if your daughter was in that accident, do you think we should have checked her? Bam. Okay, that's like, ow. God, I never even thought of that. So when you look at this, the difference between laying down, standing up, you're going to see totally different images because it is giving you an interpretation of what the computer says. This is how you actually find it. Now, there's probably other ways. I'm just going to describe the method that we've utilized over the last couple of decades on fixing people. We got to take a stress x-ray. And what that means is you're standing up, you're weight bearing. Now, do we take a lumbar x-ray on people who have had bowel disorders, anxiety, stress, and depression? Of course, because that's the gut area there. The spinal cord actually stops here. It continues on as a bundle of nerves, but around the thoracolumbar junction, that's the end of the spinal cord. And the spinal cord is a long tubular brain. You put pressure on there, it's called cauda equina syndrome. It negatively affects the entire gastrointestinal tract. It's like, good God, how could you not do that? And that is not blaspheme. It's God is good. And if he created you, you should be able to find the friggin' problem if you're given the symptoms. Yes or yes? Okay, good. It makes sense to me too. Okay, so you take this and you bend the person. Okay. Now, when you're bending the person, what we do, and this is for anyone that really wants to try this, you put your hands on the pelvis, and when they start bending, when they start to recruit, when that pelvis lifts up, you stop, because then you're isolating the low back. And you can see the picture over here on the left, on your left, how the pelvis is a little bit lower, okay, when they're bending off. The right pelvis is a little lower because they're facing us. Okay, that means that he felt it come up and they stopped. So in order to get an accurate assessment, you need an accurate film. No, I know. No, really, I teach at a doctorate level. So when you bend off to the side, the disc spaces should be narrow on the inside, wide on the outside. The problem is you're not seeing that on these films. You're not seeing a beautiful arc. You're seeing some areas where they're not functioning correctly. Now those, you could call it a herniated, bulging, slipped. Those are not accurate terms. Why? Because you want to find it on an MRI. That's not an accurate device. It's like saying, let's get a test that doesn't test if you're infected. Heck, it doesn't even test the quantity of the virus, and it's 80% false positive. Let's just call it a PCR test. Okay, no, that doesn't work either. Okay, so then you bend the person the other way. Okay, that's a little COVID humor. Okay, and you should see narrow on the inside, wide on the outside. And then that way you can assess it. Now, the weird thing is, when you get somebody, and this is the worst type of surgery you can have, they bolted the lumbar to the sacrum, in complete ignorance of brain function. Because remember, if you're altering motion in there, you're altering proprioception or communication of the brain. Then you're bolting it to the lumbar, which now the lumbar is mobile. The sacrum is held in place by ligaments. So you've permanently altered this person's biomechanics for forever. The problem is, after these surgeries, there was still pain. When we took the bending films, it was at the thoracolumbar junction, but that's not even the part of it. You're going to see that if a person has this rib cage laterally deviated, and you could try it just sitting in your chair, slide your thorax off to the side and feel where you feel it. Okay? It's going to be the low back. So if you're like this from some type of trauma and you go into the doctor and you say, look, my back hurts, and here's a drug. Oh no, we'll take an x-ray of the back. You're going to miss everything. 50% of low back issues is coming from the neck. Why? Because that spinal cord doesn't stretch real well. It doesn't stretch hardly at all. Okay? And if this is pulling like this, thrown forward, it can negatively affect the entire body. That's why they call the curve in the neck the arc of life. By the way, do you know what my boat's name is? Arc. Not A-R-K, A-R-C. People think I couldn't spell it, but no, I meant arc of life. Okay, so when you look at this, Why don't doctors see this? I don't want to belabor the point, but it's because they're not taught that you can reshape a spine. They're not taught the critical, that if a body is misaligned, you're altering communication to the brain. They're not taught that if you alter this, have some type of problem here, some type of problem in the sacrum, if you have any kind of issue there, you're altering autonomic function. Autonomic functions means resting, digesting, and repairing are limited in you. That's how you live. That is not a good thing. But to give a drug that destroys joint cartilage to temporarily alleviate the pain, steroid injections we know are ridiculous because it's not functioning from a lack of steroids that you're going to get it. And in fact, let's say that you have a spine that shows a trauma. Okay, you're going to inject in where to straighten up the spine? Nowhere. So that's foolishness. So you're injecting something that destroys the joint cartilage, and you can only do 2 or 3 injections depending on the jurisdiction you're in, because it literally damages the connective tissue. Failed back surgery. Now you can talk to some surgeons, they say they have a 98% success rate. Absolutely, but it really depends on your parameters. So if they knock you out and wake you up and you don't have any negative effects, man, that was a success. Okay, if you're putting pain in there, like if there's pain relief, well, if they have one fusion, you have a 40 to 80% success rate. 40 to 80% success rate. Is that a range? Yeah, we have a car for sale. It's either 4,000 or 8,000. No, you kind of want to know before you buy the friggin' car. If you have 3 levels, like what I'm showing you, which is very, very common, you have about a 15% success rate. Well, that's crazy. What about X-stops? And X-stops is a trip. I had one of the first guys, and they were doing a study out of Hogue, and this was back, I think in the late 90s, early 2000s. Let's say you have a problem here. Well, you'll see the nerves come out of the back half of this joint. And so typically, there's going to be a damage because that disc is bulging in. So why don't you just stick a device in between the spinous processes and crank it up to take the pressure off? Stop telling me that it's going to alter brain function. Yes, you're right. And it's not coming from the lack of that. So what happens is you get people that'll do an X-stop in a spine like this. Yes, this is one of our patients. Now, do you think that taking the pressure off of that junction of the sacrum and lumbar is dumb or dumber? Because what's happening 2 inches above that? You got a massive lateral deviation. So, no, they didn't put a zipper in, okay? Because you know that's going to make a little bit of difference. Well, what's going to happen in a couple of years? It's going to be mind-bogglingly stupid. X-stops, and they don't recommend it, blah, blah, blah. So now, let's get into how to correct this. So hopefully you got a distinction and how intricate and how complex and how important that lumbar and pelvic junction is. So now let's talk about correcting it. One of the biggest things, those machines there for traction, I'm not a big fan of because I have never seen a herniated disc ever. And I'm talking tens of thousands of people, okay, that have had a beautiful straight spine, beautifully curved with a herniated disc, okay, even though that's what you're going to hear. What happens is there's one trauma on top of another. You are never going to see a herniated disc with a perfectly straight spine. It just doesn't happen. There's going to be loss of curve or anything. Now, these traction devices, they only pull straight. So in order to correct this, you have to have a force loading in this direction, a force loading in this direction, a force loading in this direction, and a force loading in this direction. Okay, does that make sense? Now, one of the crazy things, this inversion table is one of the best things you can do if you're not American. I mean, it's amazing. Okay, well, because the reason I put that is because 54% of our children have a chronic illness or disease. 60% of our adults have a chronic illness or disease. That means your blood is thick, toxic, and stuck together. It's not holding oxygen. And then if you're looking at the multiple medications that Americans have, their blood is toxic, sick, and not working well. How would you like to invert your body and increase the blood pressure in your brain with this? No, that is not good. So when people say, hey, doc, I just got this thing. Sure, man, you could use it in about 6 months. We just got to get your blood pressure normalized off of the drugs. We got to clean up the blood. We got to take care of the toxicities. You're going to be fine, but in 6 months, you'll be able to use it. Now, this is me working on my daughter-in-law, okay? And I describe it. So what do we have? We have tables here that literally support the pelvis, suspend the abdomen. What does that do? That creates a negative pressure on the front portion of the disc. And then if the body is off to the side, I can contact here and bend the body around it, creating a negative pressure on the concave portion. It makes so much sense that if you do that, now how many times do you need to pump that or bend it? How many times? Do you want to know how many? The body's going to tell you. It's going to tell you. It's the coolest thing ever. Because these muscles, they don't have a conscious control. So once you decrease that pressure there, okay, you're actually going to see the body get corrected. It's amazing. How many times do you have to do it? Don't know. It totally depends on the human. What our protocols are, we do a pre and post x-ray at about 30 adjustments. Why? Because we're getting differences in proprioception, and I want to document that we're actually fixing the problem. Wouldn't that be nice? Okay, so let's do a poor man's traction. This is what you can do if you got friggin' agony. Now, one of the things that we do, we use a foam piece that's very, very tough. Okay, it's hard to compress. I'm pretty strong, and I'm squeezing it as hard as I can, and you can't really make it big of a dent. But this thing is placed, the bottom of the elbow is the bottom of this. So it's up high. The top would be at your bra strap. No, I don't wear one. I'm just using it as a female example, okay? So it's placed at the junction of the rib cage and low back. Okay, now imagine you have a chair with arms. I couldn't find on Shutterstock a chair with arms of a guy going like this, okay? So he's got a rocket-powered office chair. So just imagine if you're pushing down with the arms, just a little bit, just a pumping action. Remember, discs get their nutrients through what? Movement. Now, if you put this on your back, you're going to have a force loading going from the back to the front. And do not put it down here where the curve is. Do not put it down here at the lordosis. Do not put it there. Why? Because we want these muscles to work. What you're going to do is put it up here at the thoracolumbar junction, which is going to increase lordosis, and it also repositions the chest. Because you're never going to have a low back issue without some kind of thoracic or cervical component. I mean, it just makes sense. So if you push down, you're going to have a little bit of relief. You're going to have that pressure taken off. And then down and down and down, and you do that a few times, it's going to be a stopgap measure that you can help. This is the patient. Knee pain. And honestly, your knees are in great shape. But what you're seeing is an abnormal patellar tracking. And she only came in with knee pain. That's her low back. Does the low back look normal, healthy, or does it look like there's been a few traumas? And she doesn't even feel it, okay? She understands that she's had difficult menstrual cycles. There's been some anxiety and stress, but that's fine. Mind-blowing. When we look at this is the worst position you could possibly ever be in. And patients have come in there and said, yeah, my physical therapist and my doctor both said, if my back hurts, to lay on the bed and put a pillow underneath my legs. Absolutely. So if you look at this is a somewhat normal lordotic curve. You'll see the nerves come out of the back. Now, if you lay on your back and put your knees up, you flatten out the discs, okay? And what you might be able to tell is these holes where the nerves come out are now opened up. So it feels so good. It's amazing, except the discs are all reversed now. They're all wide at the back, narrow at the front, when in a normal lordotic curve, they're narrow at the back, wide at the front. So this is completely contraindicated. It's horrible. Do not do it. Here's the patient. These are 2 fake discs and bolts. The easier thing about this one, though, is they didn't bolt it to the sacrum. Once you get that, it's a challenge. But what's interesting is even after 7 surgeries, you're going to see a 6-degree curve on one side and less than a degree curve on the other. All of that pain that required all those 7 surgeries was not at that site of surgery. It doesn't mean that we're good at identifying that stuff, or we are good at identifying it, but you can't utilize unscientific behaviors, even though there's a really bitchin' machine called an MRI. Sitting is hugely important. When I see a commercial, wow, with that bladder leakage, I love these diapers. It's going, good God, you're 55, 60 years old. What the hell are you doing with bladder leakage? That doesn't make any sense. So the old mnemonic, S2, 3, and 4, keeps the ding-dong off the floor. Okay? And because it is a PG show. But it's also one of the mnemonics that you would teach, because you'll remember this. So where's the pelvic nerve? What supplies the pelvic floor? S2, 3, and 4. Okay, C3, C4, C5, keep you alive. Okay, that's the diaphragm. Okay, so all of that stuff just makes sense. But when you know that down here, you've got like a trampoline almost of muscles, and embedded in that trampoline is the coccyx, and it's just floating in there. It's detached by cartilage. Now if you're having all these stomach contents, you're sitting on this ischial tube, it's spreading apart the ischial tube, and that's going to stretch the muscles, and that's going to weaken the muscles. So once you stabilize the pelvis, you can start doing Kegel exercises, but I wouldn't recommend them until you get the pelvis stabilized, correct the disc injuries, correct the whole upper thoracic area, and then you're going to be okay. When you look at this bowel and bladder control, everything is involved in that pelvis, everything. If you have a dysfunction of the pelvis, and you're going to think, I've got Alzheimer's because I'm going to repeat this. If you have a dysfunction of the pelvis is perfect. It means that there's a dysfunction of the lumbar, thoracic, cervical, or some type of past trauma. And so what do you got to fix? You got to find the problem and fix it. So many times we had patients come in and I went to my other chiropractor and he popped it. Oh, God, I felt good, but by the time I got home, I was hurting like heck. Yeah, he's working in the wrong place. Okay, a pelvis is so much fun to adjust. It's really easy. You got a big bone here. You go like this, bam, pop. Everybody, confetti comes down from the ceiling. We're happy. Except if it's hypermobile, if it's moving too much, you don't want to adjust it. Okay, you want to stabilize that pelvis. Now, when we look at this, incontinence, this is a crime. And there's a number of medications that cause it, but you can have a problem at the thoracolumbar junction. You can have a problem here. You can have a problem where the entire spine is so distorted that it's pulling on this, causing a dysfunction. Endometriosis, pelvic dysfunction, difficult menstrual cycles, painful sex, all of that stuff. I mean, it's mind-blowing. The male and female Kegels, the way to describe it, now I wouldn't recommend you do this unless you have a good, healthy pelvis. Do you know why? Because it wouldn't work. It's like me putting a tourniquet on your arm and saying, okay, go to the gym, or no, let's put a mask on you and go ride your bike. I've seen that. Yeah, it's our world. So what you do is, and this is the greatest way to teach boys how to hold their urine when they're little kids. We're going to go water the tree. Okay? And the muscle you use to stop urine flow, okay, is the Kegel exercise. So you tighten it up and you hold it for about 5 seconds and then relax. Tighten it up, hold it for about 5 seconds and relax. This is not just going to give health to the pelvis, but this is something every pilot, truck driver, office worker should be doing. It's vitally important. Again, patient here, 48-year-old gal. Sexual dysfunction, pain when sitting, bladder problems. And what happens? You stabilize the pelvis. You got to stabilize the pelvis. And then you take care of the lumbar. Sometimes it may take a week. Sometimes if you have a surgery in there, that pelvis is always going to need to be stabilized. And what do you stabilize it with? How do you know? It's a trochanter support. Trochanter support is the simplest thing you can get. You can get it on, I think, Amazon, Mayer Distributing. Costs around $10. Okay? We give it to our patients. Why? Because we just want it stable. That's it. Because once the pelvis is stable, you're talking all of these autonomic functions can change for the positive. If you get somebody that you're adjusting that can't sleep, are they going to get better? No, they can't. If they have an unstable pelvis, are the adjustments in the low back going to help? No, it can't. None of that works. One of the ways you can tell if you do have an unstable pelvis is sit backwards in a chair like a cowgirl, or sit with your legs out really, really wide, just like your mom told you not to, because it would attract those type of guys. So then you could do little things like a water bottle, a rolled up towel, any of this stuff, but placed at the junction of the rib cage and low back. So typically at the bottom of the elbow is where the bottom of this goes. I put it too low because those guys on the chairs over there have it right in the small of their back. You don't want it. You want it up a bit higher. A ball chair is a good thing because your pelvis, if you're sitting on a flat surface, this isn't moving. If you're sitting on a ball, you're sitting on these two ischial tubes and you're always rocking this just a little bit to maintain your balance. So a ball chair is great. When you look at this is one of the technical devices that we actually give our patients. No, it is not a 4x4. It used to be. Now it's a health device. So you're going to put your ball of your foot up on this. Now my wife has got size 4 feet. Those are ridiculous. Those are like mutant. Okay, she can use this. So don't say that your foot is too small. I know, you can use it too. So this is something you do 1 minute twice a day, because if you can't do this, if you don't have dorsiflexion, if you're not able to lift up your foot, when you walk, you're going to be walking with your pelvis. Okay, so that's ridiculous. So if you're going to fix the lumbar, you got to stabilize the pelvis. You better look at the gait. You better look at the calf. You better look at how the whole dynamics are. So if you're looking at the importance of the lumbar and pelvis to your life, okay, and you're not paying attention to the flattening of the feet or the calf or the loss of good motion, you are not going to be effective at correcting them. Swelling. You have a pump on the back of your leg called the soleus. And when people have swelling, yes, I know that some of the crazy things is they'll be given a hydrochlorothiazide, a blood pressure drug called a water pill. No, water comes in glasses, okay, it's not in pill form. This is damaging thing that damages their kidneys, but it will drain the fluid out of their leg. Yes, your leg swelling will go down. We're not fixing the problem, but you're going to give this diuretic that increases your risk of stroke and damages your kidneys. Instead of telling them to gas pedal their feet, to actually use the existing pump. But if that pump has been compromised because of nerve supply, then the gas pedaling won't work. So you have to look at why the swelling is there. The rebounders are one of the best things in the world, but if you have an unstable pelvis, stabilize it. Use one of those trochanter supports, vital. This one here is one of the best exercises around, the balls. I mean, you can do everything, but it's movement that gets in there. The bones are not out of place and we don't put them into place. What we're doing is we're changing the position and motion, so we change the communication to the brain. Because your body is not supposed to be in place or out of place. You're a dynamic, living creature that needs all of this stuff working together. And it is possible. You want anti-inflammatories? Bitchin'. Take the ones that make inflammation work. It's called plants. Okay, it's amazing. They have extra electrons. They stop any free radical formation. They make healing work. So this is one way to assess it. And I'm open to any doctor that has a faster, better, more effective way on repositioning discs and regenerating. R1, full spine stress x-rays with lateral lumbar flexion and cervical flexion and extension. Heart rate variability. Why? Because you got to check their autonomic function. If a person's in a stress state, they are not going to get better. You got to find the physical, chemical, and emotional stressors. That's an adaptive response to the trauma initially. Full body thermography, why not? And today we got one of the most poisoned populations on the planet. Wouldn't it be cool to see if we have estrogen dominant pattern, if there's liver inflammation, if there's some kind of lymph stagnation? Yeah, it'd be nice to have a predictive thing that will prevent disease in the future. Cool. That's why we got one at both of our clinics. How to correct it. I know. Okay, so that's how to assess it. How to correct it? You got to find a corrective chiropractor. We had 7 questions I'm going to show you in a minute, but also that's only part of it. You've got to change the circadian rhythms. You've got to teach somebody how to sleep. You got to show them how to clean their blood with the plant-based nutrition. And if you're not taking care of the emotional component, you will not get that person better ever. Why? Because just like a Halloween cat, these muscles that run from here down to here, they're not under conscious control. If you're in anxiety, stress, or depression, those muscles are going to increase in tone. And if you have a lateral deviation and these muscles increase in tone, you're going to feel it. You're going to be upset and you're going, gosh, you're such a pain in my neck. Okay? Yeah, that's where it came from. Okay, so physical, chemical, and emotional stress. You solve that, you're hunky-dory. These are the 7 questions. All you got to do is find somebody that says yes to 5 of the 7 questions. If you find somebody that says yes to 5 of the 7 questions, but they really aren't sure or confident, they can come to one of our offices and we'll train them. They can observe us, we'll train them. It'll be cool. Do you know how much we charge to train doctors? Nothing. Nothing. Why? Because we need to help the planet, obviously. Okay, now, Millions Against Medical Mandates. I encourage you to join this group because the world is going to get crazier. Political organizations, Medical Freedom PAC, but all of this stuff, it's being shadow banned, totally banned, everything banned. We're getting it as much as we can. We're on BitChute, we're on Library, Extreme Health Academy, Dr. John Bergman. It's just with a massive amount of censorship, what we can do on these sites, we can talk about fight and cope and bites and all the other stuff. Okay? Does that make sense? Thank you very much.
Thank you.